Ladies and gentlemen, good morning, good afternoon, good evening, or perhaps even good night, but depending on where you are in the world right now. Next slide, please. On behalf of the International Pharmaceutical Federation, FIP, it is a great honor and a great pleasure to welcome you all to this session, the impact of air pollution on respiratory health and vulnerability to COVID-19. What can community pharmacists do to help? Next slide, please. My name is Lars-Åke Söderlund, and I am the president of the Community Pharmacy Section, FIP, as well as the chair for the FIP Congress Program Committee. And today I am sharing this very important session. Before we start the session, let's go through some webinar house rules. This webinar is being live streamed via YouTube, and the recording will be available at our website, fip.org. And you may ask questions using the Q&A box provided in the Zoom tool. You're welcome to provide also feedback to webinars at fip.org in order to make our presentations and our sessions even better in the future. And also I encourage you to become a member of the FIP by entering our website. It is probably the best investment you can ever make. Next slide, please. This event is sponsored by the Clean Breathing Institute. This is a scientific collaborative initiative by GSK Consumer Healthcare with a mission of reducing the health impact of air pollution to improve the quality of life. And today we have three prestigious speakers in this session. Dr. Glenys Gadding from UK, Mr. Gonzalo Sousa Pinto within FIP and from Portugal, and Dr. Sandeep Salvi from India. For this session, we have outlined some learning objectives. They are: develop knowledge about the impact of air pollution on the immune response to infectious disease. Learn about the gaps in knowledge, tools and policy to support the role of community pharmacists, and identify which tools can best support pharmacy practice in the field of respiratory health. In 2019, the World Health Organization, WHO, listed air pollution and climate change as one of the top 10 threats to global health. The WHO data shows that 9 out of 10 people breathe air containing high level of pollutants. And WHO is working with countries to monitor air pollution and improve air quality. So from smog hanging over cities to smoke inside the home, air pollution poses a major threat to health and climate. The combined effects of ambient, outdoor, and household air pollution cause about 7 million premature deaths every year, largely as a result of increased mortality from stroke, heart disease, chronic obstructive pulmonary disease, lung cancer, and acute respiratory infections. So more than 80% of people living in urban areas that monitor air pollution are exposed to air quality levels that exceed WHO guidelines limits, with low and middle income countries suffering from the highest exposures, both indoors and outdoors. As such, the effect of pollution can actually impact the health of a person at every life stage, with particular population groups being more vulnerable, mainly the extreme ages or coexisting chronic health complaints such as cardiovascular disease and respiratory diseases. So therefore, FIP works with the Clean Breathing Institute as a partner to raise the visibility of this important issue to pharmacists and their role. Pharmacists can have an important role on the awareness of the public and patients of the impact of air pollution on respiratory health and protecting patients from this harm. So today's online panel will discuss how pharmacists may expand their role in managing respiratory illness and in providing respiratory wellness, as well as identifying tools to support their practice. Why community pharmacists are key to activating practical change and self-care amongst patients, as well as the need for patient education on the impact of outdoor and indoor air pollution and the impact of air pollution on immunological resilience and response. Next slide, please. Let us now start the session, and I'm very happy to introduce the first speaker. Dr. Glenys Gadding is an honorary consultant physician in allergy and rhinology at the Royal National Throat, Nose and Ear Hospital, an honorary lecturer, senior lecturer in clinical immunology at the University College London School of Medicine. She was the secretary of the British Society for Allergy and Clinical Immunology in 2007 to 9 and president during 2009 to 2012. In 2006, she won the Society's Award for Outstanding Contribution to Clinical Allergy in UK. She was also Allergy UK Allergist of the Year in 2011, and she was awarded prizes by the British Medical Association, European Academy of Allergy and Clinical Immunology, and from the World Allergy Organization in the last few years. She has been a member of the European Academy of Allergy and Clinical Immunology for several years, and a member of the Academy's Ear, Nose and Throat Section Committee since 2004. Dr. Gadding's research interests include rhinitis and its comorbidities, including rhinosinusitis, aspirin hypersensitivity, and sublingual immunotherapy. She is the author of over 300 publications, including the position paper from the European Academy of Allergy and Clinical Immunology named Diagnostic Tools in Rhinology, and textbooks on investigative rhinology and on pediatric ENT. By this, I welcome our first speaker, Dr. Glenys Kathleen Gadding, to the floor.
Thank you very much, Lars-Åke, for that really nice introduction. It is a huge pleasure for me to be talking to you all and to such a prestigious and, I think, valuable organization. I am now going to try and take over the control of the slides. And here we go. I should be able now to show you my talk. Here are my disclosures. And as you can see, I do work for a lot of pharmaceutical companies, and I thank GSK Consumer Healthcare for making this talk possible today. Pollution is considered, as you heard, by the WHO as the greatest environmental risk to health. And as yet, COVID-19 has not yet killed 1 million people, whereas air pollution is linked to almost 7 million deaths every year. I don't know whereabouts in the world you're listening to this from, but if you're in Africa, the Middle East, India, or China, you can see here you are exposed to very high levels of PM 2.5. That's the particulate matter that comes out in diesel exhaust. But in fact, over 90% of us live in areas where air quality is below WHO standards. And sadly, there do not seem to be any safe lower limits to air pollution. So what does it do to respiratory health? Well, exposure to air pollution is now linked to more excess deaths than is smoking. And if you live near a main road, it's the equivalent to passively smoking 10 cigarettes every day. Nitrogen dioxide exposure causes 4 million new cases of asthma in children every year. 25% of premature deaths from chronic obstructive pulmonary disease in low and middle income countries are due to household air pollution exposure. We tend to think of air pollution happening mainly out of doors, but in fact, it can also be relevant inside the house. Next slide, please. Inside our houses, there are a whole variety of pollutants. Nitrogen oxides, and particularly nitrogen dioxide from cooking, ozone, radiation in some houses, biocides, all the plastics and what they're giving off, carbon dioxide, smoke, biological materials such as house dust mite, cat dander, dog dander, molds, flame retardants, many volatile organic compounds. Our homes are no longer safe spaces. Next slide, please. The average UK child spends 23 out of the 24 hours of the day indoors. And health problems linked to indoor air pollution occur in patients with asthma, patients with other causes of wheezing, those with conjunctivitis, dermatitis, and eczema. And those that are vulnerable are those at both ends of life, the children and the elderly, those with respiratory problems, and of course, the third of our population that has allergy. Next slide, please. The other important point is that factors interact synergistically. That's like 2 and 2 adding up to make 5. And this is data from Adnan Kustovic when he was working in Manchester, looking at children with asthma and whether they needed to go to hospital or not for an exacerbation of their asthma. And he found that there was a triple whammy effect. That is, if they were sensitized to an allergen, they'd made IgE, allergy antibody against it, they were exposed to that same allergen, and they got a viral cold, that triple whammy gave them an almost 20-fold risk of ending up in hospital with their asthma. So allergies and infection go together. Next slide, please. Of course, there is plenty of pollution out of doors as well. And in Europe, these come from these activities that you see here: agricultural, energy production, natural phenomena like the terrible wildfires that are happening in the world at the moment, landfill, all the fossil fuel production of various kinds, road transport giving out a lot of diesel exhaust particles, and combustion of all sorts of fuels. These are poisoning our atmosphere. Next slide, please. The vulnerable people include the group I mentioned before, but also, interestingly, recent data suggests that pregnant women and young babies are also affected by both of all PM 2.5 or ozone at ground level. These increase the risk of both preterm birth and of low birth weight. And this is not from one study, this is from meta-analyses of several studies. So this is very genuine information and fairly new. Next slide, please. Now we've all got noses, and the nose is very important. It's often ignored, but the nose is our gateway to the respiratory tract. And if we nose breathe, it will filter, warm, humidify, purify somewhere between 10 and 15,000 litres of air every day for each one of us. Inside the nose is a very important defense system. There's a mucociliary clearance system. Cells make mucus, other cells have tiny hairs called cilia that beat the mucus backwards from the nose, backwards to the back of the throat where it's swallowed. And whatever gets into that mucus, the PM10 particles, the other pollutants, will be taken backwards, swallowed, and go down to the stomach, where a lot is destroyed by gastric acid. This is a hugely important system. And when it fails in diseases like cystic fibrosis or primary ciliary dyskinesia, you can see what happens. The sufferers get terrific respiratory infections. Unfortunately, air pollution can dysregulate our immune responses. It can detract from that ciliary beating. It can stimulate chemokines that attract inflammatory cells into the nose. It can also alter antigen-presenting cells and antigen expression and twist the response towards a Th2, an allergic type response. And there's some very nice data from Japan where cedar pollen allergy was almost unknown until about the 1930s when it began to become apparent. It is now a huge problem. And when it began, it came not where there were cedar forests, but along motorways where there was the combination of cedar pollen and pollution from cars and lorries. There's also a tendency to suppress regulatory T cells. Protein oxidation can form neoantigens. Nitrogen dioxide increases the expression of ICAM1, which is the receptor for many rhinoviruses, although not for COVID-19. And macrophages get overladen. They're taking up so much that they can no longer have phagocytic capacity. And that's one possibility why COVID-19 is much worse in the elderly, because the longer you live, the more lung macrophages you have that are full of the rubbish which you've breathed in over the years. Pollution, therefore, as you might expect, increases the risk of respiratory illness. There's epidemiological evidence between outdoor nitrogen dioxide levels and deaths from respiratory disease. Such levels also increase virally induced asthma exacerbations. And same-day NO2 levels are associated with the total number of respiratory admissions, acute respiratory infections, and asthma. Children who live in polluted cities have more upper respiratory tract infections per year than those who live in cleaner cities. So this pollution is doing us all a great deal of harm. Next slide, thank you. What about COVID-19? What is the evidence? Well, there are some papers, which three of them I've read, that suggest that COVID-19 tends to be worse in polluted areas. The problem with that is that those polluted areas also have many other COVID-19 risk factors. So the jury is still out, but this does deserve immediate and in-depth experimental investigations, as has been recently called for in the paper quoted here. So, what would happen, or what might happen, if we could reduce pollution levels? Well, there's a paper on Barcelona which suggests that almost half the asthma in Barcelona is due to air pollution. And if the WHO guidelines on annual exposure were met, then 19% of all cases, if PM2.5 were reduced to WHO levels, would disappear. That would be 428. And if nitrogen dioxide was decreased, 18% of all cases attributed, that's 454, would disappear, which would certainly be worthwhile. If you look at 18 European countries, a bigger study, this one, if they complied with the WHO guidelines for PM2.5, then the 11% of childhood asthma that is thought to be attributable to that could be prevented. And that would include a startling 66,600 children. And that is really a remarkable figure. And this would be well worth doing, because once you've got asthma, you have it for the rest of your life. You cost a great deal from healthcare. And if one could prevent asthma, that would be absolutely marvelous. But we have had some reductions in pollution recently due to COVID-19 and self-isolation, people staying at home instead of going to work, people not going out to restaurants, pubs, etc. In lockdown, there were distinct impacts on air pollution levels, and you can look at the graph on the left to see the different cities and what happened to those two major pollutants, PM2.5, I think that's PM10, nitrogen dioxide. They went down. And the level of reduction of nitrogen dioxide was 40%. And there was only a 10% reduction in the average level of particulate matter over 30 days. But what we saw was 11,000 avoided deaths, 1.3 million fewer days of work absence, 6,000 fewer new asthma cases, 1,900 avoided emergency room visits, So 600 fewer preterm births, all because the pollution was reduced by lockdown. So as we say in England, every cloud has a silver lining. And finally, there are two things I wanted to mention to you, two very recent things. At the European Respiratory Society meeting in August, the paper on the left was presented, which showed that even within the European Union limits, pollution is still linked to impaired breathing in children and asthma in adults. So we have to get rid of it altogether if we can. And on the right, I think we've all been rather puzzled by the way in many societies people seem to get more and more obese. Well, there's a possibility that pollution might even relate to that. You remember what happens when it gets into your nose? It gets moved and goes down to your stomach. Well, in our guts, we have a microbiome of microorganisms, mainly bacteria. There are more of them than there are cells in our body. We have more bacterial DNA than we do have our own DNA. We are composite organisms. And that microbiome helps to drive the way our bodies work. In particular, it drives our immune responses. But in Denver, there is a brown cloud, which is mainly ozone. And a study has found that young adults exposed to higher levels of ozone have less gut microbial diversity, and they have more of the bacterial species associated with obesity and disease. So it may not only be respiratory disease that we would be preventing if we were able to reduce the ozone and nitrogen dioxide and PM10 and the rest of the pollutants. Next slide, please. So my conclusion is that air pollution is damaging to health, particularly to respiratory health, and reducing air pollution would result in significant health improvements. Thank you very much for your attention.
Thank you so very much, Dr. Scanning, for your most interesting presentation. It is actually very scaring how air pollution is one of the greatest risks for our health. And it is amazing how our lifestyle and the environment actually pose high risks for our health, and we are all affected. And there is still so much we actually can do, and that we should do, and that we need to do. And that will actually make everyone a winner. We will have all the questions answered at the end of the session, but I encourage all of you attending the session to submit your questions via the Q&A box that you have at the bottom of your screen. By that, I will now move to the next speaker, Mr. Gonzalo Sousa Pinto. Mr. Gonzalo Sousa Pinto leads the area of development and transformation of the profession at the International Pharmaceutical Federation, FIP, where he has been working since 2002. He promotes innovation and the value of pharmaceutical professional services in the area of responsible use of medicines, the prevention and management of chronic non-transmissible diseases, and also infectious diseases. He has recently co-authored the FIP guidelines for pharmacists and the pharmacy workforce on COVID-19 and the FIP Global Vaccination Advocacy Toolkit, supporting and expanding immunization coverage through pharmacists. Mr. Sousa do Pinto, welcome to give your presentation.
Sorry, I was muted for a while. I was just thanking Lars-Åke for that very kind introduction, and also congratulating Dr. Scatting for an excellent presentation that really sets the ground for my slides and my participation in this webinar. Precisely because air pollution has become such a major threat to global health, with so many ramifications and impact at so many levels, and not only respiratory health, as Dr. Scatting just explained. All health professions are really called to play a role in minimizing the impact of air pollution in health in our patients. And pharmacists, FIP believes, are excellently positioned to have a role in raising the awareness of patients and people in general and the community about the impact of air pollution and how they can protect themselves from those impacts. But this has not traditionally been a role that we have all played. We have some knowledge, we have done some work in this area, and when we have assisted our communities on how to keep healthy and prevent some disease. But this specific area may represent an expansion of our traditional roles. And precisely based on these premises, FIP has conducted, in partnership with the Clean Breathing Institute, a survey to our member organizations between May and June this year, aimed at getting a better understanding of what is the current level of awareness among pharmacists about this important global threat, but also their role in it. And to find out whether there are guidelines to support their roles in related to respiratory health and the impact of air pollution, and what are the perceived barriers and knowledge gaps also among community pharmacists, so that they can really play and fulfill a role in proactively educating and supporting the respiratory wellness of our communities. We also aimed to explore the knowledge that pharmacists have around nasal health and their use and recommendations of nasal hygiene practices that may help defend against the health impacts of air pollution exposure. So this survey was both a baseline survey that we will use as a starting point to monitor the role that pharmacists play over the years in this important area, but it was also an awareness raising survey amongst our member organizations of the importance of including the area of air pollution and the roles that pharmacists may play in this area among the scope of practice of pharmacists in their countries. So we invited 123 professional organizations, pharmacist organizations from 113 countries to participate in this survey. And we received responses from around 50% of that sample, so 62 countries, with the regional distribution that is provided in the table, on this table. So we see that the most of the responses were from the highest response rate per region was from Europe and the Western Pacific region, and also the Americas, and less so from Africa, the Eastern Mediterranean, and Southeast Asia. And for your information, although I will be presenting some of the findings from this survey in this presentation, the full report with the analysis of the data will be launched on the 15th of October. So this is sort of a peek into the survey findings. And I will be sharing with you some of the more interesting or more outstanding survey findings. So we asked what is the current role of community pharmacists in respiratory care? And the findings were, unsurprisingly, that it's support to self-care, including the use of non-prescription medicines. And this was present in 84%. And also with the same percentage of the sample, we had a role in promoting the adherence to medicines. And this includes a role, for example, in promoting the appropriate use of inhaler devices, which is a common service provided by community pharmacists in several countries. Also promoting patient education about the respiratory diseases and their prevention, and less so roles in protocol-based prescribing or renewing prescriptions for medicines for certain respiratory conditions, or also roles in screening of respiratory function and symptoms that may need further attention by other health professionals. Another question we ask is precisely to provide these roles. Pharmacists, of course, need not only the education and the training, but also guidelines, practice guidelines and protocols to support their roles in respiratory care. And we asked for which conditions these guidelines were available in their countries. As you can see, the number of respondents to this question in our questionnaire was not to 62 participants, but only 48. And among those participants, actually, only at least 50% of participants indicate that there are no guidelines at all. And the highest condition for which there are guidelines is asthma, with 50% of that sample. Followed by common cold and influenza. But for example, allergies are only in 13 countries there are guidelines to support the role of pharmacists in allergy prevention, for example, or the protection of patients against allergies or allergens. In terms of the non-pharmacological measures that are most commonly recommended by community pharmacists, the top most frequent ones are related to nasal hygiene, including nasal sprays and nasal washes, followed by gargles and other measures. And we asked respondents, so we asked our member organizations, the survey was conducted in between May and June, so this was already during the pandemic, and we asked them if they expected any changes to their roles in managing patients with respiratory symptoms after the pandemic. And this was an open text answer, so we summarized the most commonly referred expected changes. And these include an increased recognition of our role in primary healthcare and in respiratory care in particular. And this includes, of course, disease prevention and patient education, patient literacy, but also the screening of patients with symptoms of respiratory conditions. They also expect an expanded authority and scope of practice to manage respiratory conditions in the community, and an expanded authority to vaccinate, and particularly to prevent several respiratory diseases, including the seasonal influenza, for example. Also, they expect a broader use of technology for remote consultations and patient care. And this is already applied in some countries, including video consultations or telephone consultations and support to patients, especially in times, of course, of lockdowns or confinement, where people avoid as much as possible going to health facilities and may recur to the services of pharmacists, for example, for assistance and information. Also, they expect more tools to support their roles in identifying and screening respiratory diseases, including more point-of-care tests. And Dr. Salvi will be speaking about these tests and screening options in his presentation afterwards. Also, the tools and protocols for distinguishing COVID-19 from other respiratory diseases like the flu. A lot of information and guidelines have been issued by many organizations, including FIP, but of course, a lot of information was needed, especially at the time when many of the respondents answered this survey. And of course, in the demonstration of the inhaler technique, pharmacists feel that they will need additional precaution and protection because it often involves a closer contact with the patient, and prevention and early signaling of respiratory symptoms in patients. And we asked, how well do pharmacists understand the impacts of air pollution on respiratory health? So this question is about the training, foundational training of pharmacists in this area, and the knowledge to identify the gaps in knowledge that there may exist in our profession to provide these services. And the graph here on the left provides some data broken down by WHO region. And the three colors or the three bars that are presented for each of the regions, the darker one is pharmacists feel that they are well informed about the short and long-term impacts of air pollution on respiratory health, followed by the lighter blue color, in which pharmacists say that they have some knowledge, but they would require further education and training to fully develop this role. And finally, also the yellow bar says pharmacists feel that this is not an area in which pharmacists are knowledgeable about in their country. So as you can see, the majority of respondents indicated that they have some knowledge, but they would require further education and training. And in fact, if we combine the lighter blue and the yellow, where there are significant knowledge gaps, in the overall sample, this means that in 90% of the countries, pharmacists feel that they require further education and training in this area to be fully confident. And in terms of their proactivity in discussing and managing the impacts of air pollution on respiratory health, we see that for only less than 5% of the respondents actually do this as sort of as a common, generally, yes, they do it, approach patients proactively to discuss the impact of air pollution. And we see that in 49%, they do not do it on a regular basis. It's not something that is part of their daily practice, let's say. And in 47%, they say that sometimes they do it. So it's not part of mainstream practice, which of course indicates that we need to promote it further, raise the awareness of pharmacists and their organizations about the importance of this service, but also, again, provide the policy tools and the guidelines and the standard procedures and the screening tools that all support this role of pharmacists. If this is not done, we cannot expect pharmacists to actually proactively discuss this with patients. And what are the perceived barriers for not doing this proactively as a sort of a general part of pharmacists' practice? And again, we see that insufficient knowledge is the most common response, followed by no remuneration. And this means that there isn't a remuneration model in place by third-party payers, by health systems, to encourage and make this professional service by pharmacists sustainable and widely accessible in the long run. So pharmacists need, of course, to invest time in providing this, and this is skilled advice and skilled information. So, and with a clear return in terms of health outcomes for health systems, and therefore they feel that the lack of a remuneration model that supports this service is also an important barrier to be addressed. The third most common reason is that they feel this is outside of their scope of practice, and then lower percentages of respondents indicated that they felt that air pollution was not considered a particular important problem in their region, or that they do not have the time to actually provide this type of service. And what would help pharmacists discuss these impacts of air pollution with patients? For over 90% of respondents, more education and training of the pharmaceutical workforce, including changes to our foundational training curriculum, but so that every pharmacist sees this as part of their common and streamlined pharmacy practice. And this is across all pharmacists that are coming out of pharmacy school, let's say, but also through continuing professional development opportunities for them to obtain further and updated knowledge about this area. Specific training on different types of pollutants and their impact on patients' respiratory health. Also professional services and projects with a hands-on approach that they could sort of a protocol for actually delivering this service, supported by guidelines and standard operating procedures, but also information, real-time information that provide them with the knowledge they need to actually alert the community about particular situations of risk for their health, and a more coordinated approach across all health professions, and also tools and frameworks for this, including access to patient information and communication channels with other professionals that may attend and provide care to the same patients. They also feel that a helpful measure would be an open channel of communication, such as a professional hotline for any questions that may arise and that may support them in their daily practice. We asked also as part of this questionnaire whether pharmacists believe there was a link between air pollution and several viral infections, including colds, the influenza, and COVID-19. And of course, you need to put this in context. This was in May. A few months ago, the information about the impact of air pollution on the immune response to other diseases, including COVID-19, was not entirely clear. So, but this also shows that further information and not only further data about this link is necessary, but also, as Dr. Scadding already mentioned, there is already sufficient information to suggest this link, but we just need to include it in training opportunities and for pharmacists and the health workforce in general. So in terms of what tools would be most helpful and what they perceive as being the most helpful tools to identify patients at risk, we see that the most common responses, interestingly enough, are not technology-based or not device-based, let's say, but are related to information. Information on live, real-time information about air pollution risk, and also information about the patient. So using a standardized questionnaire that pharmacists can use to interview the patient and identify the risk that they may be exposed to. So those are the top two most helpful tools, followed by smart peak flow meters, rapid blood test strips, and other tools to support this role. And at the end of the survey, we asked participants if they would agree with this statement that pharmacists want to involve their role as trusted advisors and provide added value to patients through education and proactive care in the area of respiratory health and air pollution. And here there seems to be a very wide consensus, like 92% of respondents say they do believe that pharmacists need to have a role in this area. So this clearly indicates that we need to support this role and to take measures not only to provide more training and education, but to develop the policy and advocacy tools to achieve this, and also the practice support tools to achieve this. So in summary, and without taking much of your time, the current role of pharmacists is mostly related to supporting self-care, including the use of non-prescription medicines, but also the promotion of adherence and patient education, but not so much to patient screening. It is mostly reactive to patient queries and not a proactive engagement with the patient to educate them and help them protect themselves from the impact of air pollution. And the main reasons for not proactively discussing this impact with the patient are the perceived lack of knowledge and the need for education and training in this area, followed by the lack of an appropriate remuneration model that provides incentives to pharmacists for a bigger role in public health and disease prevention. So further education and training is necessary in 90% of countries, and in at least 50% of respondents, there are no guidelines to support pharmacists in respiratory health. The most common one was asthma and common cold, but we clearly need to develop more guidelines to support these roles. Nasal hygiene practices are the most commonly recommended non-pharmacological measures, and the most demanded tools to help pharmacists identify patients at risk were related to information. Real-time information about the risk of air pollution at local level, but also standardized questionnaires to identify the risk that individual patients may have. And in terms of point of care testing, respondents most frequently pointed to the value of smart peak flow meters and rapid blood test strips. Finally, pharmacists want to evolve their role as trusted advisors and to provide added value to patients through education and proactive care in the area of respiratory health and air pollution. Thank you very much for your time, and I'll be delighted to answer some questions at the end. Back to you, Lars-Åke. Thank you. Lars-Åke, you may be muted as well.
Thank you so very much, Gonzalo, for a very interesting presentation regarding the FIP survey and for sharing lots of valuable information. According to the survey in your presentation, there is really a huge need for improvement among pharmacists to acquire more knowledge about the impact of air pollution, and also how we need to start a dialogue regarding the impact of air pollution. I think your recommendations and the recommendations from the survey regarding creating more awareness, implementing the guidelines and tools, as well as remuneration models, is very important. And I also believe that actually in some countries we need to raise the awareness of this crisis on a governmental level, actually. Well, that leads us to the next presentation, but before I will introduce the next speaker, I encourage you to send your questions to us via the Q&A box at the bottom of your screen. Next speaker is Dr. Sandeep Salvi. Dr. Sandeep Salvi is a founding director of the Chest Research Foundation and a member of the board of directors for GOLD, the Global Initiative for Chronic Obstructive Pulmonary Diseases. He is also vice president of the Indian Chest Society, a member of the International Advisory Board for the Lancet Respiratory Medicine Journal, and a member of the Steering Committee on Air Pollution and Health for the Ministry of Health and Family Welfare in India. He is one of the key experts on the advisory board of the Clean Breathing Institute, the GSK Consumer Healthcare Scientific Initiative. And Dr. Salvi is trained as a pulmonologist in India and received his PhD in clinical medicine from the University of Southampton, United Kingdom. Dr. Salvi, welcome to give your presentation.
Thank you very much, Lars, for a very kind introduction. Wish you all a very good morning, good afternoon, and good evening, depending on where you're located. It gives me a great pleasure to share with you some knowledge that I have on what are the tools that pharmacists could use to support their practice in the field of respiratory health. Can I have the next slide, please? We all know that air pollution is one of the major risk factors for various chronic respiratory diseases as well as heart disease. But amongst all the air pollutants, there are only a few that seem to have a major impact on the health of the humans. Among these, particulate matter pollution that includes particles that are less than 10 microns in diameter, called PM10, or particles that are less than 2.5 microns in diameter, which are much smaller than the PM10 particles. These are the two important pollutants that have been shown to have a significant impact on the human health. But apart from these, there are various other gaseous air pollutants that seem to have a major impact as well. And these include ozone, nitrogen dioxide that primarily comes from motor vehicles, and sulfur dioxide, which also comes from motor vehicles, essentially diesel vehicles. So it is these five main pollutants that seem to have the biggest impact on human health. The air quality index is a measure that tells you what is the average level of air pollution, considering all these important five major air pollutants. And they're classified into various categories that include good, which means that the air pollution levels are fairly healthy enough for us to breathe. And then depending on the increasing levels, they're classified as satisfactory or moderate or poor or very poor or even severe and hazardous levels. 90% of the people who live on this planet Earth are exposed to pretty high levels of air pollution on a regular basis. As pharmacists, it is important to have this basic knowledge about what are the important air pollutants that affect the health and what is this air quality index, because this is one index that you could potentially use to guide your patients on how to take care of themselves, especially when the levels of air pollution are high. Next slide, please. We all know that air pollution causes various health impacts. The lung is a major organ that is affected. And as Dr. Glenys Cadding mentioned in her talk, on a daily basis, each one of us breathes about 10,000 liters of air every day. And if this air comprises of different pollutants, it is going to get deposited in different portions of the respiratory tract and lead to various symptoms. Cough is one of the most common symptoms that people experience when they're exposed to high levels of air pollution. It is perhaps the most sensitive symptom that is associated with exposure to air pollution. Then you have presence of phlegm or sputum production, which is also an important symptom that you get after exposure to different kinds of air pollutants. Wheezing, sore throat, colds or runny nose, congestion of blocked nose, stuffy nose, shortness of breath, and headache are the other symptoms that are associated with exposure to air pollutants. Some of the air pollutants produce all the symptoms, while some air pollutants produce very specific symptoms. For example, ozone, which is a very common secondary air pollutant present in most urban cities and towns, primarily presents with a cough, a dry, irritating cough with chest pain. Next slide, please. What are the tools that a pharmacist could keep in the pharmacy so that they could use them as tools to help people understand the importance of air pollution, as well as use them to even screen patients for diseases that are associated with exposure to various air pollutants. Pulse oximeter is one such tool that pharmacists could keep. And especially in this COVID pandemic, this is perhaps one of the most popular tools that pharmacists must be using. Not only do pharmacists use it, but many people buy it and keep it at home just to measure their oxygen saturation. It's a very good tool to tell if you have an underlying COVID pneumonia or any particular viral pneumonia. Because when you have a pneumonia that is associated with viruses, one of the first things that likely happens is your ability to saturate your blood with oxygen decreases. So it's a very useful screening tool that would give you information if the underlying lung is affected because of a pneumonia due to either a viral infection, which could be enhanced by exposure to various air pollutants. Care should be taken if the nails are artificial nails, or if you have applied varnishes or nail varnish or nail polish. And if you're anemic, then obviously it's going to give you false readings. So you need to be aware of these conditions. Otherwise, you're likely to make a potentially wrong diagnosis. The other tool that I particularly believe that pharmacists should keep with them is the smart spirometer. This is a very simple handheld spirometer that can be hooked up onto your smartphone. A spirometer is a device that gives you information about the patency of the airways. So if you have obstructive airway diseases such as asthma or COPD, that could be very easily picked up if you can use this screening tool in your pharmacy. So a use of a smart spirometer is something that I would recommend pharmacists to keep with them. Next, please. A peak flow meter is another device that gives you adequate information about presence of obstructive lung disease, particularly very useful in asthmatic patients, especially not only even if you want to diagnose cases of asthma, but more importantly, as a very useful follow-up tool to see how their airway function is improving or not with the treatment that has been recommended. So it's a very good follow-up tool for patients of asthma. Must be kept in your clinic, in the pharmacy, and very simple test to perform. You just need to take a deep breath and blow with one quick sharp blow into that, and you'll see the pointer move forward. You do 3 such blows and you record the highest reading out of that. And that is a good enough marker to tell how healthy the airways are of the lungs. Then the next tool that I think is also very important is a chronic respiratory questionnaire. It is a set of questions that you could ask your patients to find out if they have symptoms that are suggestive of any particular disease, or if their quality of life is particularly getting affected because of their lung health. So screening questionnaires, diagnostic questionnaires, or even questionnaires that tell you about the quality of life are extremely useful tools that pharmacies could use in their pharmacy to screen and detect respiratory problems. Next slide, please. Face masks are widely used solutions in personal protection against air pollution. And what better time than the COVID-19 pandemic, because the face mask is now going to serve a dual purpose. It will protect you against the exposure to various harmful air pollutants, but it will also protect you from spreading and catching the COVID-19 infection. There are various types of masks that are available, which the pharmacist must be well versed with, because there's a lot of lack of adequate knowledge that many people have about which is a mask that is useful and how to even use those masks. So there's a surgical mask, there is an N95 mask, or there are these cloth masks. And sometimes it can be very difficult to decide which one of them is the right one for your patient. However, amongst all these, the N95 mask has probably received the most amount of attention, largely because it seems to be very useful to protect oneself and protect others from the COVID-19 pandemic. It's important to know what is N and what is 95. The NIOSH, or the National Institute of Occupational Safety and Health, based in the United States, they had a very specific standard for developing masks to protect people from various occupational exposures. And they classified them into 3 categories, N, R, and P. N stands for those masks which are not resistant to oil particles. So if you're in an area where there are fine oily particles, then this is not the right mask for you. The R mask is resistant to oil. So you can use this mask, but only for a limited period of time in areas where there are oily particles. And the P type of a mask is the one that is oil proof. So that is a mask that you should wear where you suspect oily particles in the environment. But by and large, for people who do not work in occupational settings, doing the normal day-to-day life practice, they only need the N type of the mask because it's not necessary to have the oil resistant one. So the N type of a mask which can filter off at least 95% of the particles that are more than 0.3 microns in diameter, is the one that is recommended. You can have an N95 or an N99 or even an N100 mask, depending on how you want to, how much particles you want to filter. So if you really want to have almost 100% protection against these particles, then you wear the N100 mask. But there's a problem with that. Makes breathing quite difficult. So it's a trade-off. The more efficient you want, the greater it is to breathe through it. And therefore, it's important to have some middle strategy, and that is the N95 mask. 95% of the particles are blocked, and it also at the same time helps you to breathe relatively better as compared to the other masks. Then you have the surgical mask and the cloth mask, and it's important to know whether the surgical masks are the genuine ones or the fake ones. There are a lot of fake masks that are available in the market. And as pharmacists, it's important to understand and identify the genuine and the fake masks. Next, please. Apart from that, you may have heard about the neti pot, which has been used during the ancient Ayurvedic years by the physicians at that time to get rid of their nose from nasal secretions and the nasal diseases that they suffered from. So it's simple. It's a pot that helps you wash your nose. You can use either plain, normal, warm water or even saline water. Both are allowed, both are used. One of the useful non-pharmacological approaches to clean your nose, in case there are pollutants that have got deposited over there, or there are viruses that are meandering over there, about to cause infection, you can get rid of them by flushing your nose with warm water or saline water with this neti pot. Next slide, please. Other than that, you have access to the various nasal filters that are now widely available. There are many companies who have started making these. They're in the market. You need to be clear about the beneficial effects of these nasal filters. Remember that these nasal filters are effective only against large sized particles, especially pollen grains. So if somebody suffers with nasal allergies, especially to grass pollen or tree pollen, the size of these pollen particles is around 30 to 50 microns. And these nasal filters seem to be quite efficient against these large size particles. But when it comes to smaller size particles, the PM 2.5 or the PM 10, or even the ultrafine particles that are present in the urban cities and towns coming from motor vehicles, then these nasal filters are not good enough. They're good enough only for large size particles, the big dust particles, and the pollen grains, which are bigger in size. So although they are useful, the filtration capacity is not good enough for smaller size particles. People have tried to develop nasal filters with efficiency to even block small particles, but then it makes breathing quite difficult, and many people stopped using it. So as of now, the only convenient nasal filters are the ones that filter large sized particles. And it's important to have knowledge about this, because I would certainly not recommend this for patients to protect themselves from fine or ultrafine particles, because many patients would believe that this would protect them. Next slide, please. And then you have the various mobile applications that not only give you the information about air pollution levels at that point of time in that location. There are lots of these apps that are widely available across the globe. And it's a very useful information which pharmacists could inform their patients that over here the pollution levels are so and so, they're pretty high. For somebody like you who suffers with an underlying respiratory disorder like asthma or COPD, and you need to be careful. I think you need to stay indoors until the pollution levels come down. You can help the patients get access to these app sites. Get yourself well versed with these sites, and you can assist your patients in educating them about the level, not only the levels, but even educating them about the potential harmful effects of the pollutants that are there in that region. Next slide, please. And so other lifestyle changes that can help a person to prevent exposure to air pollutants, quite a few of them: moderate outdoor physical activity when there are high levels of air pollution. So certainly you don't jog on the street where there are pollution levels, where there are high levels of air pollution. Optimize driving style and vehicle settings. Say, example, you're waiting at a traffic signal, switch off the engine so that you don't produce air pollution at the traffic signals. Simple activities like these can have a big impact on the levels of exposure to air pollution that people are there in the vicinity. Choose travel routes that minimize near road air pollution exposures. So there are some apps that can help you, guide you, that this is a route that you should take, which is less polluted. Shift from motorized to active transport wherever possible. Using a bicycle is perhaps the most cleanest way of reducing the levels of air pollution. Or even if you have access to electric motor vehicles, those are also equally good. And then minimizing personal exposure to household air pollution, especially in the low and middle income countries, where there's a lot of use of mosquito coils and incense burning and cooking without exhaust fan. The pollution levels inside the house can be quite significant. Next, please. Nasal sprays, nasal washes, and nasal gels are something that could potentially be used as therapeutic pharmacological approaches to help patients relieve the risk of getting symptomatic because of exposure to air pollutants. And many of these have certainly shown beneficial effects. Next slide, please. Daily nasal washing with saline solution can reduce the impact of air pollution on health. There are a lot of these that are now available, very easy to use, and research has clearly indicated that they can reduce the harmful effects of exposure to air pollutants. They not only flush away the pollutants that are deposited in the mucosa of the respiratory tract, especially the upper respiratory tract, but because of the pollutants, there's a lot of secondary bacterial infection or viral infection that accompanies that can also be easily flushed out by these saline solutions that are either available as nasal sprays or nasal washes, and particularly useful in children and in areas where the pollution levels are high. Next slide, please. So this is the final slide. Pharmacists can act as trusted messengers and can educate people for preventive measures. But for this, the pharmacists need to be educated themselves. The survey that Gonzalo just presented before my talk clearly indicates that the pharmacists also lack this knowledge, and they must first of all get themselves educated before they can pass on that information to the patients at large. It's important to acclimatize yourself with this new knowledge. There are lots of screening tools that you could potentially keep in your clinic, diagnostic tools, pharmacological interventions that could have a major impact on reducing the burden of the harmful effects associated with air pollution. So pharmacists have a very important role to play. And I believe that this is time for them to start realizing this and start creating an impact on people's health. Thank you very much.
Thank you so very much, Dr. Salve, for a most interesting and valuable presentation regarding the tools to support pharmacy practice in the field of respiratory health. There are actually a lot of both tools and approaches we can use to minimize the risks of air pollution, and also when to recommend a specific tool and when not to recommend it. And it's also really interesting when one reflects over that our lifestyle and our behavior actually are extremely important in reducing the levels of air pollution. I will now invite all the speakers to the stage, so to say, where we actually will have some questions for you. I will start with a question to Dr. Skading. You describe the early indication that air pollution increases the chance of severe forms of COVID-19. Do you think we can make changes quick enough to help?
That's a very good question. I think the changes that occurred in lockdown were quite significant. So I think we probably could make changes. The other thing that has happened, of course, is people are flying much less, and aeroplanes produce a great deal of pollution. So I think with the will to do it, we could make changes which might well help with COVID-19. Also, I think if more people wore masks when they were out and about, that would help a great deal. There's a great deal of confusion about mask wearing. The evidence is that it does help, and we should all be wearing them when we are mixing with other people, especially indoors.
Yes, thank you so very much. Mr. Sousa Pinto, you mentioned that just 10% of pharmacists recommend forms of non-pharmacological advice, such as good environmental hygiene and allergen avoidance. Do you think this should be increased, and why? I'm sorry, you are muted.
Sorry. I was asking, you mean in terms of providing this service and advice to patients in terms of?
Yes.
Yes. Well, pharmacists are really placed in a way that they know their community, they know the patients they are serving, they know, for example, what types of indoor or outdoor air pollutants there may be in the specific area where this patient may live, or what are the cultural practices that may have an impact in terms of producing pollutants and allergens. But of course, at the same time, even though we can customize the advice, maybe it's not possible for every patient to actually change the environment that they live in terms of their exposure to air pollution. Even indoors, and I mean, in terms of sharing housing or being affected by the habits or the practices of other people's people living in the same dwellings or house, or even work environments that they may not be able to modify in terms of the air pollution present in their daily environment. But what they might do in those cases is then adopt measures to prevent air pollution from entering the nose and from affecting them in a more direct way, and to manage the symptoms as they arise as early as possible, and to monitor the appearance of those symptoms through the devices and the screening methods that Dr. Salvi described, for example.
Okay, thank you so very much. Dr. Salvi, there is a lot of conflicting media coverage relating the use of masks in the context of COVID-19. And you mentioned that the N95 masks should be used when pollution is anticipated, but governments are only recommending non-PPE face coverings. How can pharmacists ensure a clear, consistent, and accurate message is received by patients? And linked to this, we have actually a question from Yolanda Robles from the Philippines saying or asking, would the prolonged use of face masks affect respiratory health?
Brilliant questions. When the COVID pandemic started, the only protective gear that many people believed was effective was the N95 mask. And because this became popular through the media, everybody went and started buying the N95 masks. And as a result, the healthcare community people, the people who are taking care of the patients, the doctors and the nurses and the paramedics, they were left with hardly any N95 masks to use. And that became a big problem, not only in my country, but in many, many countries across the world. And then the WHO had to actually intervene and say that, hey, look here, the N95 mask is more important for the healthcare providers, the doctors and the nurses, people at large. If you have access to it, free access to it, by all means use it. But if you don't, then please prefer to give these masks that are not available so easily to the healthcare providers. And it is because of this conflicting statement that N95 is good, but N95 should only be used by the healthcare providers. There was a lot of confusion that was created, but that now seems to have sorted out, because a lot of companies have started making N95 masks, although many of them, I believe, are fake N95 masks. So they're flooding it now, and many people are using it. Now, having said that, the N95 is not the only mask that can protect you from COVID-19. The simple triple layer surgical mask, a genuine surgical mask, can be good enough to protect you from COVID-19 or to prevent the spread of the COVID-19. And more recent studies using the cloth mask, the triple layer cloth mask, has also shown to be effective in reducing the spread of the COVID-19. So as the new knowledge is emerging, it's just not the N95, it's a surgical mask, and the cloth masks, which are as good as the N95 mask. So that knowledge now is changing with time, and the pharmacists need to keep themselves abreast with all this. Just a quick word of caution, the N95 mask is available with a valve and also available without a valve. I see a lot of people using the valved N95 mask in the COVID pandemic, which I would recommend not to use, because the valve easily allows the breath and the cough to come out from a person who is likely to be infected. And if he's wearing a valve mask, he's likely to spread the infection to the others. So a non-valved N95 mask is something that I would recommend in the COVID pandemic. And the question that was asked about, are there any harmful effects of prolonged use of the mask? It is important to wear the mask well. What is well? It has to be tight fitting. So tight fitting mask comes with its own drawbacks. Some people feel claustrophobic when they're wearing a very tight fitting mask. Some people find it difficult to breathe. And there are instances where, especially athletes who have been jogging around wearing a very tight fitting N95 mask, collapse because of the inability to breathe in easily through these masks. So the adverse effects of difficulty of breathing has been noted in some cases, especially asthmatics and those with underlying congestive heart failure are the ones who may be more vulnerable to the side effects of these tight fitting masks. So be a little more careful. A surgical mask is going to be a lot more easier to breathe and give you the same level of protection.
Thank you so very much for your wise recommendations. Dr. Skerding, what can be done inside the home to reduce irritation caused by air pollution? And is actually indoor air purifiers really effective?
The things one can do, first of all, if you're allergic, there are several measures you can take to reduce allergen exposure to things like house dust mites. The most effective is comprehensive allergen protective bedding, because the average bed contains 2 million house dust mites. The other thing you can do is to wash the bedding frequently and in a fairly hot wash, because low temperatures do not kill house dust mites. Ventilation of the home is hugely important, because molds and house dust mites thrive in poorly ventilated homes. Also, you can help to reduce pollution by good ventilation. Having plants in the home is also helpful. NASA found this out initially, so having house plants can help to purify your air. Another thing is not to have lots of chemicals in your home. Don't use a whole range of chemical cleaners. You can get rid of most things with hot water or with a little soap. The chemicals are associated with the development of asthma. The more chemicals you have in your home, the more that your child is likely to get asthma. So those are some of the things that you can do. Oh, and don't cook with gas. gas produces nitrogen dioxide, or don't cook with solid fuels of any kind, I'm afraid that electricity is the best, the cleanest form of cooking, heat.
Thank you so very much. Also very valuable and wise advice. Gonzalo, you mentioned that in the survey we saw that only 44% of the pharmacists feel somewhat proactive about the role in respiratory care, and that over 90% of the respondents feel that better training is a big part of the solution. What training would you say is currently available, and where do you think the gaps are?
Thank you for the question. Well, FIP, I mean, there's multiple examples of training online and provided by different providers, but FIP has also started paying some more attention to the impact of air pollution and respiratory health over the last year or 18 months, and we have organized a few webinars on that, which are available in our library of webinars to our members on our website. And also this event that we are doing and the publication of this survey report will really inform our strategies of what types of trainings are most needed and how to focus and how to develop those materials, both in terms of webinars or guidelines and in collaboration with our member organization. So FIP, this survey and the report that we will publish is really sort of a starting point and a scanning, horizon scanning exercise so that we can inform our plans from now on. So we will definitely reinforce and expand our offer of training in this area to support the role of pharmacists as well.
Yes, thank you so very much, Gonzalo. Dr. Salvi, you mentioned that apps that monitor air quality and give advice on how to reduce the associated risk. Will these apps replace some of the roles of the traditional pharmacist? And is there a risk that in doing so, the nuances of face-to-face consultation will be lost, resulting in poor air quality care?
Thank you for that question. Well, it's important to appreciate that these apps are not just for the patients, they're for the pharmacists as well. They can use it themselves also. Used properly, they will enhance and support the role of pharmacists. In a sense, enabling the pharmacists to offer better quality care, give them the correct and the latest information about the pollution levels. And for those patients who want to use them, it will certainly empower them for self-care, which is a large part of what successful pharmacy care is all about. So yes, pharmacists can certainly complement the apps that are available for patients to use.
Thank you. We have a question here from Philip Harrison. He says, I have seen no data shown that masks in the community have any effect on limiting the spread of COVID-19. The chief epidemiologist in Sweden, the assistant medical officer in the UK, and the medical director of British Columbia and Canada are skeptical. Dr. Scadding and Dr. Salvi, what is your comment? Actually, is there evidence?
Yes, there is certainly evidence that masks work. There's quite a lot of epidemiological evidence, and I would not take anybody in Sweden very seriously on COVID. They have a very odd approach to it. I'm not at all sure which assistant medical officer in the UK has said this, but the vast majority of them are promoting masks. And I'm afraid I cannot quote you an actual reference, but certainly there is evidence that masks do work, and particularly when you cannot practice social distancing.
Yes.
There is a recent report published in the Lancet, and I would recommend the person who asked this question to go and read this article. It's a very, very useful article that talks about the evidence that is currently available about the importance of masks in preventing the spread of COVID-19. The evidence seems to be quite good. It is evolving, and I think there's absolutely no question, as Dr. Scadding said, that masks are absolutely important and useful must be used in the COVID-19 pandemic.
Thank you so very much. Gonzalo, please.
Yes, I was just to add to that, the guidelines that FIP published to support pharmacists throughout in responding to the COVID-19 pandemic has a section on masks that compiles the evidence available for the different types of masks and what information pharmacists can actually provide to the community on this. And as both Dr. Scadding and Dr. Salvi were saying, the evidence is there to support the use of masks, and of course the cross protection that masks offer as well in the community, that some types of masks might not provide a full protection of the person, him or herself, but if everyone is wearing surgical masks at least, then there is a cross protection in the community that has an impact in the spread of COVID-19. So I do encourage you to consult this, the guidelines that are available on our resource center, fip.org/coronavirus. They're all there. Thank you.
Yes.
Could I make one further point?
Yes, please.
Patients with hay fever, with pollen allergy, are likely to sneeze. Sneezing spreads particles far and wide, well over 2 meters. So if you have a pollen allergy and you are outside, you really should be wearing a mask all the time.
Thank you so very much. Excellent recommendations. We also have a comment from Mrs. Eva Teresalmi in Finland that the mask discussion is always very confusing as the protection to yourself and to others are mixed. And there is also the big task for pharmacists to educate people to use the masks in the right way, because there are many different ideas on how to use masks. And actually, I was waiting for a friend to come to the Stockholm airport just 2 weeks ago. And I have never seen so many different ways of wearing a face mask. I was really shocked, more or less. Dr. Salve, please.
The primary function of wearing a mask is to prevent the spread of infection, not to protect yourself from catching the infection. Yeah. I think most people don't realize that. By simply wearing a mask, if you happen to be COVID positive, asymptomatic COVID positive, I think you're going to cause much better benefit to the society just by wearing a mask, because you're going to reduce the spread of it. How much protection you're going to get from wearing a mask is relatively less important. You have to wear a mask so that others don't get infected. And I think that's a message that is very important for people to know.
Yes, very important. We have a question from Mrs. Samira Shamas in Jordan, and she is saying that for the pharmacists to render all these counseling, don't you agree as a panel that the pharma industry should have a closer relationship with the pharmacist in promoting these tools as they do to the doctor? Any comment?
Yeah, Gonzalo, I think he's got all the background knowledge to give an answer to this.
Well, yes, not only from the industry, but I think that pharmacist professional organizations have a role to play in providing guidelines and standing operating procedures with evidence-based information and guidance to support these roles by pharmacists. So not attached to a specific product or brand, but actually provide the evidence to support these roles and the use of different devices or technologies to protect people from the impacts of air pollution.
Dr. Scadding, please.
There's some very useful information at Euphoria, and that is spelled EUFOREA. It's the European Forum on Chronic Respiratory Diseases. The website is euphoria.eu, and it has information not only for healthcare professionals, but also for patients. And I think pharmacists could learn quite a lot from going to that website.
Thank you so much. We have a question from Michael Ogbuefi, and he is asking, how can I distinguish a fake mask from a genuine mask?
Well, thank you for that question. if you ask me, at least in an Indian market about a month ago, if you randomly took 10 N95 masks, 8 out of them would be fake and only 2 of them would have been genuine. Now, this is what happens in developing countries. I'm not sure what happens in the developed world. But there is a way to identify whether the mask is genuine or fake. If there's a website that gives you all the information about how to identify that, the labeling that is there on the N95 mask has to be appropriate. And unless those specific requirements are not there on that mask, then you should be very you should be careful that it is likely to be a fake mask. But there are lots of ways of knowing that. I think there's a lot of information available on the net for that.
Yes, Gonzalo, would you like to add a comment?
Well, I think that that question, in the same way that it could apply to fake medicines and to counterfeits, it also depends on where and how you actually procure or obtain those products. And an important piece of advice is that you only get them from reliable providers, that they themselves need to ensure that the procurement of those products follows the legitimate supply chain, and only acquire products that are certified by health authorities of being legitimate and of the appropriate quality and safety. So I think that it's also, of course, in the recent months with COVID-19, the need for masks has led people to produce and many producers and to buy masks and other devices from other types of providers just to supply a huge demand. But I think that now that it's coming to a more sort of stable situation in terms of supply, that the advice is that to only buy from reliable providers.
Yes, thank you so very much. And I see that we are running out of time, so I guess we have to close the questions for this time, but I think that we will take them into consideration and update the information on the FIP website regarding COVID-19 and what pharmacists and pharmacies can do based on existing evidence. So we can actually conclude this session by saying that air pollution kills 7 million people each year, from diseases such as cancer, stroke, heart and lung disease, and it also impacts people's vulnerability to infectious respiratory diseases and pandemics. And the evidence that air pollution is contributing to the ill health of the population, it continues to grow, and actions actually must be taken now. I think that air pollution and climate change are dramatically shifting the global pattern of respiratory diseases, and community pharmacists are key to creating awareness, and we need to actually do this a lot more. We need to ensure that patients are getting practical advice as well as recommendations how to manage both short and long-term effects of air pollution on respiratory health. And the evolving role of the community pharmacist, as well as the most accessible healthcare provider in the prevention and management of non-communicable diseases, is extremely important for a sustainable and accessible healthcare system. And the emerging role of community pharmacists in both reactive respiratory illness and proactive individual and community respiratory wellness is thus essential. I would say that every breath we take is that air pollution has an effect over lifetime, from intra-utero through the older age to the older age. And the impact that air pollution has upon a child's health has the potential to affect their well-being negatively into adulthood, and also therefore any improvements will have both short and long-term benefits. I would like to thank you all for attending and joining us today in this very important session. And of course, a very special thank you to our distinguished speakers, Dr. Shadok, Mr. Susado Pinto, and Dr. Salvi, for very interesting and outstanding presentation, as well as your valuable input, expertise, and insights. So please join us at our other sessions during this week. For example, the 2 hot topic sessions tomorrow linked to COVID-19. And I also encourage you to become members of FIP if you are not yet a member, because that might be one of the best investments you can make. Thank you all so very much for today, for joining us and attending this session. And once again, thank you so very much to our prestigious speakers. Goodbye.
Thank you for chairing.
Thank you.
Thank you very much.
Bye.
Bye-bye. Have a good day.
Bye-bye.